Good evening, ladies and gentlemen. I'm Heather, a part-time phlebotomist, and I will be talking to you today about phlebotomy. There are 3 key points I'd like to inform you guys on today. Then I'll demonstrate how to collect the blood sample. Now let's learn about phlebotomy and blood. Phlebotomy is the act or practice of opening a vein by incision or puncture to remove red blood cells from the body. Phlebotomy is also known as venipuncture. States www.education.yahoo.com. Blood is the substance that flows through our veins and arteries. It consists of a liquid component and a cellular component. The liquid part of blood is called plasma. The cellular components include red blood cells, white blood cells, and platelets. Red blood cells carries oxygen from the lungs throughout our body. White blood cells help fight infection. Platelets help in clotting. Now that we are more familiar with phlebotomy and blood, let's learn why collecting a blood sample is important. When you collect a blood sample, you are collecting a specimen for laboratory analysis. That is necessary for the care of the patient. What is a blood test? They're medical tests that analyze samples of a person's body fluids, tissue, or waste. Blood test gives important information to diagnose medical conditions, for health screenings, or to monitor treatment. Lab tests are one of the best ways for your healthcare provider to find out what's going on with your body. Now that we understand the importance of blood sample, let's learn how to obtain a blood sample. I'll briefly discuss the process of obtaining a blood sample. Prepare supplies and area. Use all safety measures. Properly identify patient. Skillfully obtain blood sample. Collect enough for required tests. Collect in the correct tubes and label the collection tubes. My information was referenced in the 12th edition, so you're going to collect the blood specimen. An Introduction to Phlebotomy by editor Frederick L. Kilch, MD, PhD. Now that we understand the steps of the procedure, let me demonstrate collecting a blood sample. Collecting a blood sample. I as the phlebotomist and Vaughn as the patient. Hi, I'm Heather. With the lab, your healthcare provider ordered some lab tests on you today. I'm here to draw your blood. What's your name?
Vaughn Patton.
And your date of birth?
March 7th, 1990.
And what's your phone number?
476-7050.
Okay. Well, let me just look for a vein here. The best one to obtain a blood sample. There's a good one. So I found a good vein to use. I'll now apply some gloves. I'll clean the site. Have my tourniquet in place. I'll grip the needle holder with the bevel side of the needle up. And I'll remove my tube, release the tourniquet, use cotton ball and pressure, dispose of my shards, I'll label my collection tube. Discard my gloves. I wash my hands when water is not available. Use hand sanitizer until water and soap are available. Well, we're done, and thank you. You were a great patient. I'll take your specimen tubes down to the lab. Now that we all have a better understanding how to properly obtain a blood sample, we learned what phlebotomy and blood are, the importance of obtaining a blood sample, the process of obtaining a blood sample, and we witnessed the collection of a blood sample. I sure hope this was educational for all of us. We'll benefit from being more familiar with phlebotomy and its reasons. You never know when your healthcare provider might order some lab tests. A few more references are www.ocr.org and www.tpub.com. I enjoyed informing all of you about phlebotomy today. Thank you and have a wonderful day. Thanks for your time. Thank you.